The NHS Litigation Authority is an arm's length body of the Department of Health. It collates all of the claims that are reported in the NHS to do with clinical negligence and non-clinical negligence. We have around about 15,000 of those reported a year at a cost of about 1.3 billion. So the most important thing that we can do to help the NHS be safer is to learn from those claims to prevent them from happening again. The challenges over the next few years for the NHS Litigation Authority is the increasing rise of claims, the increasing cost associated with those claims, and also the system in terms of learning from it as a whole system. So if you've got disparate organisations doing separate things in relation to safety, it doesn't help. It doesn't help the front line, it burdens the front line, and it really doesn't actually reduce harm. So those three challenges are our most important things to address. So we share learning from the litigation claims across the whole of the NHS in a number of different ways. We work with national organisations by influencing the Care Quality Commission to ask the right questions when they go into organisations, by influencing the improvement bodies so that they think about what kind of solutions should they develop in terms of the things that we're picking up. And also we influence across the system with regards to clinicians in respect of things like royal colleges. So for example, the main claims that are being reported to us relate to maternity, surgery and accident and emergency. So the most important thing we can do is work with the royal colleges and the professional groups related to those three areas. And by doing so, what that means is that they influence their members to improve care according to guidelines and standards. And in addition, we have three focused advisory groups in those areas: maternity, surgery and accident emergency. And those advisory groups are made up of national individuals, i.e. people who represent NHS England or the Care Quality Commission, experts in safety, and crucially clinicians from all spectrums, so nursing and junior doctors and consultants and so on. So that means that what we can do is influence across the system at a national level and also at the front line. So the NHS Litigation Authority has a number of mechanisms in which it can also drive improvements in safety. One of those is a financial incentive. So what it used to do was assess organisations against risk management standards. And if you passed the assessments at either level 1, 2 or 3, you would get a corresponding discount of 10%, 20% or 30% in relation to the contribution that you put into the scheme. What we have done is actually moved away from that approach for a number of reasons, being that it was hugely burdensome on frontline staff. It duplicated a lot of what the other regulatory organisations were doing in the system, and also gave the impression that the NHS Litigation Authority was a pseudo-regulator. And we've shifted it into becoming an organisation that's about delivering a service for our members, so a very positive approach. What we have also done is looked at whether we should incentivise good practice by financially giving trusts money up front, or punishing trusts that are unsafe. And you have to look at those two different things. And what we've decided is actually the most positive thing to do is to start reward and recognise good practice, and maybe even upfront pay people to do good practice. And so it is a unique aspect of the NHS Litigation Authority to be able to use money to incentivise good care, and also money to help organisations reduce harm.